In more local news, the Ministry of Health expressed that they've observed the strategic value of health to the country, Dominica, and held a press gathering to provide an update on their MOUs, plans and challenges that they face as a ministry, as well as informing the public on information gathered from ministerial visits to different countries in efforts to improve on health services offered in Dominica. Here is Dr. Kenneth Daru, Minister for Health.
In terms of the Cuba trip, as I said, it was very fruitful. Very fruitful. We would have known, and I would have said at the previous press release that sometime last year, Cuba signed a new agreement with CARICOM countries as it pertains to collaboration, not just in the area and health, but collaboration between CARICOM and Cuba itself. We would know, of course, that Cuba has been very instrumental in terms of developing the health sector, in terms of training doctors. That was way back as probably 1978, from what I recall. Yes, there was a lapse of 15 years in between when a new regime took over in 1980, which really didn't take advantage of this Cuban scholarship. But I think from 1996, when we established diplomatic ties with Cuba, we've had this steady stream of medical doctors being trained in Cuba. Myself, I'm Cuban trained and very proud I'm Cuban trained medical doctor. So what they did is that we would have also noticed that in recent years, the number of medical scholarships would have decreased. But I think starting from this new academic year, 2015-2016 academic year, the number of scholarships has gone back to 7 per year. And in addition to this, they're also offering free specialties every year. Now these specialties are going to be of our choosing based on the country's need.
After having carefully identified some of the areas that are mostly critical with regards to health in Dominica, the specialties will be made. From a number of visits to medical firms, they also saw the need for greater collaboration, being that most of the time Dominican patients are to be flown to either Guadeloupe or Martinique for medical attention. On that note, he announced that the medical services firm in Cuba offered the ministry to sign a memorandum of understanding. Upon review, he informed that very soon in the near future, they will be signing an MOU to have patients transferred to Cuba for medical care.